This topic tonight is very important to me. I remember being diagnosed back in 2019 and laying in bed for over 10 days. And at that time, I wish somebody would have pulled me up so we can have this conversation. However, it's never too late to get your mental health together. Welcome, Lisa. I'm so excited to be having this discussion with you tonight. How are you?
Fine, thank you. Thank you, Atiba. I'm very excited for tonight as well. And welcome everyone. I'm happy that they chose their Thursday night. Everyone chose their Thursday night to tune in for this important topic.
Thank you. And so, however, before we start this very important discussion, I just want to reiterate what Tia said. Please put your questions in the Q&A and we will try to get to as many as we can. So, Lisa, let's start this hot conversation off. Can we start by identifying and discussing some of the more prevalent needs of mental health for Black women?
Sure. So it's a good question. I think it's important to note that mental health needs can be influenced by a number of factors, right? So they include cultural experiences shape familiar to Black women. They include societal and personal, cultural, personal, and societal influences. Some may include racial and gender discrimination. So Black women often experience both racial and gender-based discrimination, which can lead to, feeling marginalized, frustrated, angry, which negatively impacts our mental health. We also experience quite a lot of microaggressions, some subtle and some that are not. And we frequently encounter them in our work, in our community spaces, and they often erode our self-esteem and contribute to added stress and anxiety. Another reason why we need to address this is because of cultural stigma. The stigma surrounding mental health within the Black communities and about seeking mental health is often discouraged, especially among Black women. And so it prevents us from discussing our mental health challenges. And there's many others, including, historical traumas, our family, our great-grandparents, they experienced quite a lot of traumatic events, racial violence, systemic discrimination, and that also leads to intergenerational effects on our mental health as well.
For our own mental health and emotional well-being when dealing with breast cancer. What can the impact be on our mental health if we don't find ways to talk about it or seek support?
Right. So I think that it's important for Black women to get mental health support when managing a breast cancer diagnosis. It's crucial to receive mental health support. It helps us to to cope better emotionally. Because a breast cancer diagnosis is quite overwhelming, it's traumatic, and it makes us be, as you mentioned, laying in bed for how many weeks? You're dealing with fear, with anxiety, with sadness, with loss, a loss of your reality, a loss of the person that you used to be. And so it's important to help to get coping strategies and help to process those emotions. It also helps us if it's important for us to seek mental health, because it also helps us to manage the physical and the mental demand. Black women, unfortunately, studies have shown that we are under more chronic stress, and it adversely affects us emotionally and physically. So again, mental health, improving your mental health will definitely help with your quality of life. Why should we always be on a lot of us, we like to say the term, I stay ready, and it's like, we can't keep staying ready. Like, we need to fall back sometimes and experience vulnerability and, and being caring to ourselves. So instead of staying ready, I challenge everyone tonight to just be on standby. Just don't stay ready all the time, because it does, for us to constantly be in that heightened space of having to react and to check people and having to fight all the time, it really does take a toll. And through getting mental health support that can build our relationships, our social support, that will empower us as well while we're improving our mental health.
Yeah, I am so glad you said that because I feel like, who was it, Erica Badu, when she called us bag ladies? I'm carrying so many bags, and then
Yes,
people don't tell you how many bags come with this breast cancer diagnosis. So
that's
thank you, because I'm tired of carrying these bags, girl. I'm ready to put them down.
right. Exactly. And we have the layer, when you get the diagnosis, you add the layers of all the things that we've talked about, our culture, the stigmas, the stereotypes, the microaggressions, all of those things. And then to add a cancer diagnosis, it really is just like it's a ticking time bomb, and we need to get help for it.
You have never lied. Thank you for that. Thank you, audience. I see the questions coming in. So, Lisa, question number one, is it best to seek out a therapist that specializes in oncology?
I think it is important if possible. I think, as I can see through the chat, many people are reaching out from different states. People that women that are in diverse breast cancer settings, breast cancer organizations, or diverse breast cancer clinics. They may not have access to an oncology social worker. So I would definitely suggest reaching out to non-for-profit organizations, speaking to your doctor. And I think even reaching out to in groups and in settings like this, where you can network with people and find out, girl, where are you getting help from, or to talk to people so that they can then share the resources that they have. I think with COVID, one of the benefits of COVID was us being able to do things like this remotely. We're able to connect via our online online Zoom chats, Zoom groups. So there's definitely organizations that are out there, and Black therapists and, Black or BIPOC therapists to help you to get through on this journey.
Thank you. And the second question, thank you, Ms. Tiff, for your question. Are mental health services usually covered under insurance, or are they mostly out of pocket?
Some of them are. Some mental health services are covered through your insurance, so you can definitely contact the number on the back of your health insurance card. It might say behavioral health, or it's an 800 number. Call and ask them. If they call and ask if there are any participating providers in your area, you could give them your zip code, and then you can go ahead and follow up. There are many organizations that are offering free mental health support, especially in oncology, through various organizations. For instance, there's Cancer Care, which is a nationally known organization that does provide up to 12 free sessions. So I would definitely reach out to them. And you can also, I think, we talk about self-care a lot in our communities, and I know that cost definitely is a factor, but if you have to choose between even seeing a therapist once a month and having a co-payment, I would probably choose to see the therapist and get my nails done the following week, so, or, get my wash and retwist or something like that. I think we really have to put value on those type of things, those type of self-care, which is our mental health, which should come first.
So if I'm hearing you correctly, we need to prioritize. Let's speak up and get the support that we deserve so we can overcome our challenges.
Absolutely. That's it. Yes.
Thank you. I have another question. All right, audience is on fire tonight. Keep them coming. Hey, Rhonda. Hey, Rhonda says, how can I determine if my mental health is affected when I'm such a strong-willed person? Great question.
Right. So, you have to start looking at, you said you're strong-willed, and I know that in our communities, we have the strong Black woman stereotype, or strong Black woman, or superwoman syndrome. And so, yes, we can be strong, but is that strength preventing you from being your authentic self? Is that strength making it difficult for you to cope? So you have to really be in touch with that. You have to look, are you pretending to be a strong person in front of your family, in front of your children, your husband? Yeah, I'm okay, I'm all right. No, you're not all right. You had a double mastectomy. how can someone be all right with that? So I think that it's okay. Yes, we want to be strong and we want to show resilience to our family, but are you really strong at night after you finish up treatment or after you, whether you've initially gotten your diagnosis or you're on that cancer journey and you're getting treatment? Yes, you can be, it takes a lot out of you emotionally. So I would definitely choose to advise you to keep in touch with those emotions, find ways to, journal, write your emotions down, sit in those feelings sometimes, and then look and see, what, am I feeling sad? Am I feeling overwhelmed? And if you are, definitely seek help. I'd be remiss not to mention that this month is Suicide Awareness Month, and a lot of Black women, we all, even if we don't have a plan, we have, we sometimes have thoughts. So think about that when you're in those quiet times and those quiet moments. Am I feeling, am I really being genuine, or am I really a superwoman, which is a myth, or am I really feeling some sadness or some forlornness, or just not feeling happy with the way things are going? And why fake it? Why pretend?
You are dropping gems. I am definitely one. I'm with you. I rather sit in my emotions to really, is this what I'm feeling? And then most importantly, you have to be, it is okay to not always feel strong. It is okay to want to be soft and pink. So if I'm hearing you, feel the feels, really understand so you know how to treat yourself better the
Right.
next day, the next day, and the next day. Love that.
Absolutely.
We've got some more questions for you. Stacy says, how do you get out of your own way in order to get through this process? She often feels like she's trying to figure it out on her own, which she does not think is always good.
Right. And we all need somebody. I think Black women, and I'm speaking totally transparent, myself included. I think sometimes we try to process everything on our own. We ruminate about it in our minds. We're trying to figure it out alone. We say we have so many friends. We have 10 sisters and 5 brothers. We have we have family, and we won't reach out to them. So I would definitely suggest, know your support system, reach out to them, whether it's your mother, a sibling, a close girlfriend. And sometimes I know that privacy is a big issue for myself, being Jamaican and being Caribbean. We don't want everybody in our business. We don't, we're very secretive, and that prevents us from getting help. So I would definitely suggest, if you don't feel comfortable with it, with our business coming back to you, then pay somebody via your insurance, or a free therapy, and sit and talk with them, so that once you put it there and you're vulnerable and you put everything out there, you won't have to hear it come back to you. So acknowledge that there are challenges to having a breast cancer diagnosis. Acknowledge that you're not a superwoman. Acknowledge that these emotions are real, and get help.
I love that. And again, what I heard was, team, it is okay to take our business past the front porch, especially if we're going to a professional. We
Yes,
deserve to be supported and treated. So
absolutely.
thank you for that. We've got
Absolutely.
some more questions. Cheryl says, and this is a great question, is there a direct correlation between stress and cancer?
Well, I'm not a physician, but there are studies that show that due to all of the things that we mentioned about the trauma, the having, as I said, to stay ready all the time. There's a term that is called weathering, that it seems like African American women especially goes through, where because of all the things that whether it's just mental health challenges, or even the physical challenges, using our hearts, overworking our hearts, as I said, having to stay ready all the time, it does weather our bodies. And say if we appear, because Black don't crack, if we appear to be 50, inside we may look like we're 65 or 70. And you can look that up also. It's called weathering. So yes, I'm sure that there is some correlation. Again, I'm a doctoral student, but I'm not a medical doctor. So I would look into that and ask about that.
Thank you. And around here, we speak things into existence. So, hey, future doctor, hey. We have another great question from Ms. Clark. Really good one. How do you suggest dealing with treatment medications that are directly affecting your mental health?
Right. So in the clinic where I work, this comes up often. We do have a psychiatrist that's there. We have myself, the social worker, and other social workers and other disciplines that provide emotional support. If you feel that your medication is affecting you, affecting your mental health, are you having suicidal thoughts or ideations? Are you feeling totally, we know that one of the effects of chemotherapies is feeling quite tired and fatigued. I would definitely suggest following up with your doctor. Follow up with your oncologist, your hematologist. Find out, is there any way that they can work with you? Maybe you need a lower dosage of something. If you're having insomnia, if you're having increased anxiety or depression, speak to someone. Say, doctor, I've been feeling so anxious. I just don't even know how to, explain it, because we, suffering from anxiety. And then you tell them, and maybe they can prescribe something. The other thing is to actually, well, first, before I get into that, in addition to them prescribing something for you, you can also look into ways, whether it's walking or the thing, we talk about direct correlation with our food, our diet, and other things, eating or doing things that you enjoy, taking a walk, helping you with sleep, helping you to reduce anxiety. So I would definitely suggest speaking to your doctor, finding ways to, because I know sometimes we like to do holistic, we like to do a little medication with some holistic practices as well, but you have to be willing and open to speak with your doctor. Start there first.
So it's okay to be brave and speak up and really let your doctor in so he or she can give you the support that you deserve.
Absolutely.
I feel that. I feel that. Another question. Thank you, Angela. Angela feels that there is such a stereotype about African American women as being tough and strong, that most of us feel that we have to rise to the occasion. And most people confuse a Black woman being persistent and proactive as being hard and strong. What advice do you have to overcome that, especially when you are asking a doctor that may not look like you for a support, especially sensitive support like mental health?
Right. The first thing I would do, and I have to do this myself, I'm speaking from experience, and even now being a clinician myself, I go into the doctor's office and I'm ready, right? And it makes me kind of anxious. My blood pressure is high. I don't want people talking to me a certain way. And it's crazy. I'm going in thinking this, right? So I think the first thing is to drop the cape, right? Drop the superwoman cape at the door. You do want to advocate for yourself. You do want to have someone there with you to advocate with you and for you. Things might slip your mind, so have someone there. But I think that it's important that you go in from a sense of, and even saying it is a little bit difficult for me, going in a sense with a sense of vulnerability. You're there, you're going to listen, you're going to take notes, but you're also going to advocate for yourself. Even if the person doesn't look like you, we can already put the walls up and the barriers up and saying, we know, oh, this is an Asian lady or this is a white doctor. I know that they're probably going to talk crazy to me, right? And maybe they're not. So going with a clean slate and build rapport. A lot of us are coming from spaces where there's a lot of medical mistrust and distrust. Our grandparents told us about what they went through. And again, you're going in ready with the boxing gloves on. So I think it's important to drop the cape, go in with a clean slate, establish rapport with the oncologist, the team that you have. And now when, if they don't want to listen to you, then that's another thing, but I think in the clinical setting, we're trying to, it's a relationship. We're building a relationship with someone who is going to be fighting for you and fighting for you as you fight for your life. So start there first.
Put them boxing gloves on and let's be ready to get in the ring, not only with cancer, but you got to fight mental health too, because you need a strong mental health in order to overcome this disease. So thank you for that. We've got some more great questions. One from an anonymous attendee. Can you discuss some particular challenges that you've heard from Black women fighting metastatic breast cancer when it comes to mental health? Are there any common denominators that you hear from Black women fighting mental health and metastatic breast cancer?
Right. I think just like what we talked about, it's always about um, one, lack of cultural competence, just being fearful. Is this white doctor? Is this uh, whoever doctor going to look at me differently? Are they going to treat me the same way? Am I going to get the standard of care that everybody else will get? A lot of time it's the distrust. I've worked in the South, I've worked in the North, and as we can see with COVID, um, from the time of the Tuskegee syphilis experiment, people still are referencing that even when it comes to clinical trials, a vaccine, everything. There's a level of distrust that we cannot get rid of because we've been taken advantage of in many different settings, including healthcare settings. So, and so those are two. And the third one is the superwoman syndrome. I think it's very hard for women, Black women especially, to show any type of vulnerability. We are taught to be resilient. If you stub your toe, keep it moving, keep it moving. If somebody's treating you badly at work, keep it going, get over it. And you have to be strong and show face and smile, myself included, smiling at work when I'm really, dying on the inside. That has happened. And I'm sure many of you that resonates with you. So those are the themes, just not feeling not feeling that you're going to get the right treatment, the superwoman syndrome. And I forgot the third one that I said. But
It's okay. It's recorded. We're gonna make sure to share the gems that you are dropping because you are saying a word here tonight, Lisa. So we have another great question. How do we deal with breast cancer and our spouses or partners? Trying to deal with the two conflicting emotions can be very challenging. So can you share some tips on how to balance the two?
So I always say to patients that cancer not only affects the woman or the man, now we're talking about women, but it does not only affect the woman that is diagnosed, it affects the entire family. And many of us, we have partners, husbands, spouses, whoever that are there with us, and they're in shock as well. Oh my gosh, we plan out our lives, as human beings, we think we're in control and we're not. But we plan out our lives. I'm going to get married at this age and we're going to retire at that age. I'm going to put 20 years in. And then all of a sudden you have a cancer diagnosis. So it's important. I always say, whether you have cancer or not, it's all about communication with your partner. It is okay if you get a diagnosis of cancer and you are laying in your bed crying at night. It's okay to cry and say to your partner, your husband, and say, I am scared. And a lot of people, a lot of women, Black women, we don't do that. There's no, think about it. You've been living with someone, whether it's for 5 years, you've had children, they see you naked, they see your body, they see you without your wig on, they see you with your hair undone, they see you with your face mask on, but you can't tell them that I'm scared. And I think once you start that, I think marriage, as we know, is like, it's an emotional connection as well. So it's important to be vulnerable, and it start with your spouse or whoever you're with, who you're sharing your room with, your bed with. And so it's important to say, I'm afraid. And that in turn will help the spouse to say to you, I'm scared too. And then it's just like, okay, so what are we going to do? So I think it's all about, again, vulnerability. Some of us, I think we're too strong to even tell the spouses that we're with, to tell our children mommy is afraid, I'm afraid. Because our children are modeling that. Our spouses will know what to give to us. How to expect our husband or our wife to know what to give to us and what we need if we can't tell them what we want, what our expectations are. I'm scared and I need you. And we go from there. And if it continues, obviously you guys are going to treatment, you're doing all of this together. The dynamics do change in a relationship with cancer, as all of us know. Roles are changed. You have to rely on somebody. Black women, we don't want anybody to give us a bath or, or to help us to make a little dinner. We can just do it ourselves. Your husband may not make the rice. I'm talking to myself too. He may not know how to make rice the same way that you do with the quickness, but it might take you a half an hour, 45 minutes to get something to eat, but allow it. Allow yourself to be taken care of. Allow yourself to be emotionally and physically supported.
Hearing you say that, I feel like, but you know what? If I'm here helping to get the advice, I'm gonna go ahead and put on my grown woman wig and take this advice in and do better.
Yes.
So now that I'm so glad you said that, because one of the next questions is, how do you rekindle that intimacy after going through breast cancer treatment?
Right. So I'm not a sex therapist. I have all these disclaimers. But I think that, sometimes in the clinic we do have that. I mean, I'm in my 40s now, I'm middle-aged, and I think our body changes just change without even having a cancer diagnosis. And I think that it's important to again communicate with your husband or partner and tell them what you'd like. And if you I know nowadays there's so many different things that are out there that can help with I'm trying to find the right words, with with your intimacy and making things a little bit more easier. And so I think that you and your husband or partner can sit and talk and figure out what are some things that to make it easier for them. We know that, some of the things include dryness and, what does that look like? Because you're dealing with body image issues as well. So again, it's about talking and really looking into intimacy. It may not even mean having any penetration. You may just need to lay next to each other and touch the areas that that have been affected by the cancer. It may require a lot of, like back in the day, a lot of heavy petting, so maybe something like that. Or if you need to put on like really nice underwear and bras or whatever, a role play, then that works for you, then do that too. But I think that it's really about communication. Intimacy doesn't mean sex and penetration. It could just be going on a date night. I think women, we keep, it goes from here, from our brains to our vaginas, down to, so, intimacy for you might mean your husband making sure that the house is clean. And then you're able to, the dishes are taken care of after you have finished up treatment. And then you could relax and do heavy petting after, right?
You have never lied, because how many days you come in, dinner done, house clean? It's like, what?
Yes.
So we're giving out some birthday gifts today.
Yes.
Thank you for that. I have another great question from an anonymous attendee. What are some tips when dealing with neurodiversity, specifically ADHD, looking for employment and trying to overcome and live in survivorship?
Wow. So those are a lot of things. I think it's important to first, practice self-compassion. It sounds like the person knows that have a existing diagnosis. There may be seeing someone, but give yourself some self-compassion. You may look into some mindfulness and relaxation techniques to help you. You mentioned ADHD. I don't know if you have a therapist or someone that you're seeing. They can also help with this as well, whether it's medication management, setting realistic expectations, helping you to stay on task, and maybe writing and prioritizing things down. But I would definitely start with even seeing a lot of people now, people have life coaches, therapists, and then tying it back to mental health. The support that you're getting from this person or this group with other women, you'd be surprised. Maybe other women are also dealing with the same things that you are. And you could be like, hey, girl, what do you do? Seek support and speak to your primary care doctor or a therapist.
One of the things I've consistently hearing is communication. So I appreciate you allowing us to, one, sit in the fields so you can really understand what you're feeling, how to ask the doctor, always advocate for yourself. It's pretty much speak up, because at the end of the day, a closed mouth will not get fed. So the more we speak up, and language equals access. So the more people can hear you, the better support they can provide and ultimately offer resources.
Absolutely.
So I'm with you on that.
Mhm.
So this is a great question. Sometimes I feel judged by my stunted career progression due to breast cancer. How do I explain my place in life when it's not where everyone expected me to be?
Right. So that could be quite difficult, especially if, I think that happens a lot with our AYA, our young adult patients. But even so, right? A lot of us, I run a support group for Black women, and this came up. A young woman, she went to school, she completed her degree, she's a pharmacist, and
Mm,
that's taken away from her. Her career you know, um, is null and void now because of her diagnosis. And it's met with a lot of resentment. It's a lot of grief. You might have the student loan still hovering and getting ready to, let's not even get into that, right? So it's very challenging, but is there a way for you to find, in our work, it gives us purpose. It gives us, we'll feel good going to work, and getting in there and doing what we enjoy and what we went to school for. So I think, again, it's about self-compassion. And even if for a moment, if you're on disability, or if you take some time off, the main goal is to hopefully return to that. And sometimes, and I've noticed this in groups as well, that sometimes, whether you're a physician, whether you are a house cleaner, whatever your job is, right, it was of great importance to you. And sometimes you might end up stopping, regretting that it happened, but something else may come out of it. A lot of women, they become advocates. They're always helping and being in the community and doing things, and finding ways to help others. So other opportunities can open up. You may not be able to work full-time. Maybe you can do part-time and do some other things on the side. A lot of us are quite skilled and gifted with, whether it's sewing, knitting, doing talks, cooking, whatever it is. I think that there are definitely opportunities for you to kind of get your mojo back in some instances, and
mm,
to be able to reinvent yourself, and to build on what you had before. So don't get discouraged. Don't get discouraged. I think that there are definitely opportunities, and reach out to other women to find out what they're doing as well. Rewriting, maybe doing some consulting work. There are just many different opportunities for you to still have that purposeful life.
I love that, life with purpose.
Mhm.
So this is a really great question, and probably one I should have started with. What are some signs that a person may need mental health treatment?
So again, if you're feeling, if you feel, and so a lot of us, we know that we're depressed, and we just keep pushing the feelings off. If you're tearful, if you're crying all the time, you don't want to get out of bed, if you are feeling hopeless, if you are feeling a lot of fear, a lot of just high anxiety, you could be angry, just it could be so many different things. If you're feeling that way, what was the question? You said if you're feeling, repeat the last part of the question for me.
So the question is, how do you know that you need mental health treatment?
Mhm. Right. So if you're feeling any of those symptoms, I would definitely suggest speaking to your doctor, because sometimes we might just be angry and we're just like, just angry and screaming at everybody. And that could be a part of the depression too. It can manifest into other things. So I would definitely suggest, again, that's why the lines of communication need to be open with your oncologist, with whoever you're seeing. If you have a social worker within your clinic, you can speak to them about these different symptoms that you're having, these different moods, if you're up and down, because some of us have had even emotional challenges before the cancer diagnosis, mixed in with chemotherapy, radiation, and other things, and not having proper coping skills. So it's important to follow up with your doctor and speak to a mental health provider before it gets worse and before it continues to erode your life.
Thank you for that. I know we're down to our last 3 minutes, and we do have some questions. So I'll work with the team to figure out how we can get these additional questions answered after our time. However, one of the last questions is how to navigate conversations about dying with the people closest to you.
Right. So it's really important. I think for myself, I remember the first time that I honestly like thought about death. I was nursing my newborn son 21 years ago in the hospital. And, my son was probably 2 days old. And I looked down and I said, oh my God, one of these days, I'm going to die. Like I was just like, oh my gosh, I'm going to die. And I think that dying is a very challenging topic for many of us. It's taboo culturally. A lot of, we'd say, don't speak death over me, don't,
Mhm.
Jamaicans will say, in Caribbean will say, don't, like you're telling somebody, if you even say that they look sick or to death, you're like, you're speaking death on me. So it's a topic, even in American culture, that we don't discuss enough. The same way that we live, we're all going to die. But when you have a diagnosis, and I think that we need to have those conversations with our spouses, with our partners, with our children, age appropriately, of course. If you have a 3-year-old that and you got diagnosed with cancer, I don't think you should just jump out and say that you're, because you don't jump out and say that you're going to die. But I think that as far as with with speaking with your family members, you can have that conversation. And again, it goes back to, you know what, I'm feeling scared, and having that conversation, making things set in place. Important to have advanced directives. What do you want? Do you want to be resuscitated? Do you not want to be resuscitated? Do you have a healthcare proxy, or do people know in the event that something should happen in case of a medical emergency? What is it that you would need to, that you'd want to have done? A will, all of those things, having a will. What do you want for your children? All of those things, right? So I think it's important to, again, speak with your family members. They may not want to hear it, and you can kind of spoon feed it to them, because and you want to prepare. Whether we have a diagnosis or not, it's important to prepare for when that happens. And it's one less thing for us to think about as we're putting all those things in, whether it's a will or healthcare advanced directive. So it's definitely, I would do it. And you can seek out other organizations to help you. There are a lot of End Well projects. There are many different organizations that are giving you the opportunity and the skills to have these conversations with your family members.
So I wanted to first start off with just introducing our group, the Bench to Community Initiative, and tell you our origin story. I'm a huge Marvel fan, so this is our origin story, and I'll get started with just a few slides to introduce you all to how we ended up here today. So there really wouldn't be a Bench to Community Initiative without this particular project, the Cost of Beauty. And the Cost of Beauty project essentially was Black women coming together from the community to answer a question. Are the chemicals in our hair products, our specifically Black women's products, increasing our risk for breast cancer? And what they did as community advocates was bring this question to an academic at Loma Linda University to develop the Cost of Beauty project. And we use this term that Tiah already mentioned called the Community-Based Participatory Research Strategy, CBPR for short. And we were able to engage over 400 individuals in this conversation around our personal care products, specifically hair products, and everything else in between. And what we ended up finding was that hair is synonymous with our identity for our community. A lot of people didn't know what endocrine disrupting chemicals were, EDCs for short, but by the end of this conversation, you all will hear this term often and have an idea of what they are. And they also provided various different strategies to help us get the word out to community members like yourselves, like social media, going to communal spaces like hair salons and churches, etc. And we've done some really important work. But one of the things that really hit home during the conversations that we had with community members was this knee-jerk reaction to the conversation that we were coming for something else, that everything causes cancer. So why do we need to focus on our hair products specifically? Because hair, again, is so ingrained in our communities and is oftentimes, for many of us as Black women, connected to our identity. So one of the things that we continued with this project was do a lot of report outs. And there were questions from the community that kept coming up. Specifically, well, if EDCs exist and they are harmful, what is the actual biological outcome of these products? What are they doing to our bodies? That was one of the questions that kept reoccurring. We also lacked a lot of representation from this community, from Black breast cancer survivors. And we wanted your voices to be really front and center as we continue to do this amazing work. And as we share more of this information with people, folks wanted to know, well, what can they do about it? How can they reduce their risks specifically to exposures from these endocrine disrupting chemicals? So during my postdoctoral studies, I brought together a team of community advocates. Tiah is one of those members, as well as other survivors and community folks, to answer some of the questions that community members had and to continue this bi-directional dialogue. And this is how the Bench to Community initiative was birthed. We were able to include more survivor voices as a part of this dialogue. And then we also added a laboratory component to this conversation and looking at cell-specific differences, specifically looking at parabens, which we found in many products that we use on a daily basis, and how they were essentially how estrogen was regulating the gene expression of these particular chemicals, how they were using that to for luminal A breast cancer cell lines specifically. That's a conversation that Dr. Tapia is going to share more with us about and later on in this presentation. But I just wanted to kind of give you all a little bit of a context about why we are here today and how we've been able to continue to do this work on behalf of our community members. It started with questions from you. So I'm gonna encourage you all as we go through this conversation and as we continue this introduction to endocrine disrupting chemicals and breast cancer risk, that you do bring those questions to the forefront throughout this presentation. Because for me personally, as a community advocate and a researcher, your questions are the ones that we utilize to help move the research agenda forward as it relates to this topic area. So without further ado, I'm going to go ahead and give you all an introduction of this conversation. To get started in using the chat, go ahead and tell me one word that you would use to describe your hair. So I'll start. I would describe my hair as versatile, as I am celebrating 1 year of locking my hair. So I'm just wondering, for all of you all out there, what is one word that you would use to describe your hair? And if you are feeling up to it, tell us why. So go ahead and use the chat. Crown, beautiful. Thirsty, all right. Strong. I have 4C hair, so my hair is oftentimes thirsty, soft, natural, moody. Amen to that. Magical. Shantae says fine, natural, curly, natural, etc. So we all can attest to our hair has so many different meanings to who we are as individuals. We also have hair that is portrayed in popular media. India Ari declares to us that she is not her hair, but the soul that lives within. Solange proclaims that touching of her hair and many of our own, as we describe it as our crowns, is dangerous territory, so don't ask the question. And at one point in time, Willow just urged us to whip our hairs back and forth. So what does hair have to do with this conversation about EDC exposures and breast cancer? Well, when we ask Black women specifically around this conversation about, well, what is hair? As I've shared earlier, hair has to do with everything. Right. So in asking the question, one stylist specifically told us as a part of the Cost of Beauty project, it, meaning hair, has to do with your health. It's unfortunately how important it is, because most of us would not go anywhere in a ponytail. In other words, we are not going to walk out the house looking any type of way. I am originally from West Africa, so as Lisa shared with her Caribbean Jamaican background, there are a lot of things in our communities that we take seriously, and our appearance is one of those that have been ingrained in me as a child. And one of them is you don't go out the house without combing your hair. So one of the things that we also have to acknowledge when we talk about Black hair, especially here in the United States, is the politics in our society related to our hair that upholds these Eurocentric ideals of beauty as the gold standard. We also have to acknowledge this fact when we're talking about discrimination and racism as it relates to our hair as Black women. As have been shared, we carry a lot. And unfortunately, if it wasn't for a legislation such as the Crown Act, for some of us, our hair would get us fired from our jobs. But the other thing that we have to acknowledge, which is a quote from one of our Black males, that if the majority of commercials and ads that we saw looked like Lupita from 12 Years a Slave, well, everything then would be flipped on its head. So that is the politics of Black hair and other politics of being Black here in the United States that we have to acknowledge when we are discussing this particular topic. But when we go back to the first conversation related to how does hair and health intersect? How do they come together? I'm going to illustrate that for us in the next couple of slides. So again, in using the chat, everyone has been doing a great job about it already. On the screen, I want you to see 3 products. And the question is simple. Which product do you think has the most hazardous chemicals? So go ahead and use 1, 2, 3 in the chat. And one of the things that I want you to keep in mind in the next slide when I reveal the answer is that number 1, the total number of chemicals in the products that you use on an everyday basis, it's not the same as the number of ingredients that are listed on the bottle. Number 2, some of the chemicals with the highest health hazards like phthalates and parabens are known endocrine disrupting chemicals. And number 3, each of these products have an F word in common. It may not be the one that you automatically think of, but we will talk more about that later on in the presentation as well. So as we are going through the chat, I see a number of responses. You only see 2 products. Okay, so we have 3 on the screen. Most individuals are stating 1 or 2, 3 for some. Okay, so 1, 2, or 3. So people are still voting. And I believe the majority of folks, I see a number of 1s and 2s, 1s and 3s, etc. So let's continue this conversation. All right, we have 1, okay, the final vote. So now for those of you that stated number 2, that would be the product with the most hazardous chemicals contained in that one product. So Neosho says, I knew it, it was number 2. Which is the unfortunate reality is that the children's product, Just For Me, I don't know, for me as a child growing up, my mom actually used to use Just For Me perm on my hair as well. And unfortunately, this particular product from Just For Me contains over 196 chemicals versus the 29 that are actually listed on the bottle. So as I mentioned, the number of chemicals that are in a bottle does not necessarily equal to the number of ingredients that are listed. And 24 of these 196 chemicals have been linked to chronic health concerns, including cancer. So in other words, the product that you use to potentially clean your tub has less harmful chemicals than the products that you use on your child's hair. And the F word that I mentioned previously is the word fragrance. That is one of the reasons why there are such high numbers of chemicals that have been connected to dangerous health outcomes. And fragrance is one word that can mean dozens to hundreds of chemicals that you would never see listed on the bottle because it is protected by a trade secret. So Unfortunately, the individuals that have the information, so if you look on your bottle, it's in most of our products, it gives us that smell good, etc. And unfortunately, a lot of these chemicals contain endocrine disrupting chemicals that are not good for our health. So as we continue the conversation, again, continue to drop your questions in the Q&A section and we will take care of them later. You've heard me say a number of times already, endocrine disrupting chemicals, or EDCs for short. So I'm going to let you know now, what are they if you have not heard this term before. EDCs are chemicals that are ubiquitous. They are everywhere in our environment, and they interfere with the body's endocrine system. And our endocrine system is made up of glands and organs that produce, store, and secrete hormones. So in other words, these chemicals interfere with the way the body's hormones could potentially be working. Again, as I mentioned, they are everywhere in our environment. They are ubiquitous, including our personal care products. And they can affect your health, including your risk to cancer. And for the remainder of this conversation, what I'm going to focus on is EDC exposures and breast cancer risk, with an emphasis on Black women. But before I get to that, I know there are a number of survivors, thrivers, and overcomers, some of the language that I've learned from Tiah over the years as she described her journey, that are among us today. So I want to take this pause and to really invite all of you all that have a survivorship journey and a story to just introduce that story to us. So go ahead and use the chat and let us know who you are as an individual. If you have a survivorship story, please share that with us in the chat as well. And as we're doing that, I'm also reminded of my friend Koma, or Coco, and her story. She was diagnosed with triple negative inflammatory breast cancer at the age of 29. She was given 2 years to live and told that she would never have children. However, that is not her full testimony. She is now an 18-year breast cancer survivor. She is a mother of a young race car driver, a wife, an author, and a supporter of our Bench to Community initiative, right? And amen to that. I often want to share stories of reflections from our survivors community, because while we mourn those that are not with us, unfortunately, because of this disease, we also want to take time to celebrate the stories of women in this space, in our communities, and the over 4 billion lives that are still with us today because of research and screening and advancements in treatment. And so thank you, Tammy, for sharing your story of being a stage 0 survivor from Virginia. Tiah, who is a 2-time overcomer and thriver, a 5.5-year triple positive overcomer from Kawana. I apologize if I'm butchering that name. Our TNBC stage 2 during COVID, Moniko, who is now stationed in South Korea as a military spouse. Thank you, Moniko, and thank you so much for your service as well. As a military spouse myself, I just want to say thank you so much for all the work that you're doing to support your family, and I hope that you're getting the support that you need as well. There are so many survivorship stories that are among us, and I encourage you all to take a look at the chat to just drop a heart even for the space as well, because we want to celebrate those that are still with us. And some of the statistics that we know about this disease is that 40% of Black women, for example, are unfortunately going to die from this particular diagnosis. 5 to 10% of this particular individuals that get diagnosed is because of hereditary, so it's in our genes. And lastly, unfortunately, Black women are also more likely to get triple negative breast cancer, which are aggressive cancer types that often come back after treatment. So as we talk about the higher incidence of Black women younger than the age of 40, as I share Coco's story with you all, Tiah is also another thriver who was diagnosed younger than the age of 40. For the remainder of this presentation, what I'm going to do is focus on how potentially exposures to EDC exposures in personal care products may explain some of the differences or disparities in health outcomes that we see between Black and white women. So with that said, so EDCs and breast cancer, how does it relate to one another? I'm going to use two disciplines to explain this particular relationship. One is from the epidemiological literature, which is a public health discipline, and then also from a laboratory discipline as well. And what we know from the epidemiological literature is, or overall, is that Black women carry the burden of EDC exposures found in our hair and other personal care products. What does that look like exactly? We use these products prior to the age of 13. Hair oils and relaxers, hair dyes, specifically hair oils and relaxers have been associated with early menarche, which is a breast cancer risk factor. And hair dyes have been associated with an increased risk for breast cancer. We also know that parabens, which are preservatives found in our personal care products and in a lot of our products, are known EDCs, or endocrine disrupting chemicals. And now we know what those are specifically. And these chemicals have been found in higher concentrations in urine samples of Black women. And these chemicals have also been shown to increase cell growth, decrease cell death, and alter gene expression of breast cancer cell lines. One of the founders, the founder of Black Women for Wellness, Jan Robinson Flint, really shares this statement to really wrap up and summarize all of the information that I've shared on these two bullet points, to say that Black women are overexposed and underprotected when it comes to EDC exposures in our personal care products. Specifically, I'm going to share with you how, in the context of exposures from chemicals contained in hair dyes and relaxers, in the next couple of slides. And in summary, I'm highlighting some of the work by my mentor, Dr. Dede Llanos from Columbia University, and from some of the research that she's published, the use of dark hair dyes, specifically the frequency of use of these products and the application of these products, whether you are doing it at home or at a hair salon by a professional, have been associated with an increased risk of breast cancer. So for the sake of time, I'm not going to go over each of these bullets, but please feel free to take a screenshot and I can answer questions specifically to them later on in the Q&A. It's the same conversation when we see that we see with relaxers and breast cancer risk. Whether you have used a relaxer or hair straightening product in the past, it could also increase your risk for breast cancer, depending on the usage, the length of time of the use, and the application by a professional in the hair care industry, or if you are doing it yourself at home. And these are some of the years in terms of variations and usage that are represented here on the slide as well. And again, I'm going to encourage you all to take some time to look at some of the variations related to usage, frequency, etc., and then we can answer specific questions during the Q&A. What I would like to do now is have Jazma Tapia take the presentation over and provide some context, continued context as it relates to the laboratory data from the Bench to Community initiative. So Dr. Tapia, the floor is yours.
Thank you, Dr. Teteh, and thank you all for having us here today. Yes, I am going to share some information that we have found in the lab, some results based on this project with paraben exposure and breast cancer in Black women. Please go to the next slide. So to approach this question of, are women at a higher risk of increased breast cancer due to the exposure of parabens, we wanted to start by first looking at what we know, or what is known already in literature. And so we went to the Environmental Working Group, which is a group that tests different products, and there's all these different hazardous chemicals. And you can see here on the screen on the left-hand side where we're looking at ingredient of concern. I bulleted 3 of them. We see propylparaben, methylparaben, and butylparaben. And then on the right-hand side of that chart are the product categories with the highest frequencies. These are products that are marketed to Black women, and they do contain these parabens. You can see the frequency of those. So we know that these parabens, and these 3 are some of the common ones found in these products. We know that they do contain hazardous hazardous, they on a hazardous scale, we know that they range from a moderate to a high. And so we wanted to focus on these three moving forward with the project. We wanted to know whether or not the parabens actually increase breast cancer risk and whether paraben action messes with the signaling of the estrogen receptor. So is there any interaction there? We already know in literature that studies have looked at paraben action in breast cancer, looking at European ancestry breast cancer cells. But there is very, very limited data on Black cell lines. And so that's where we come into play. And because we do already have some literature already on a European ancestry breast cancer cell lines and parabens, we expect to see similar effects occurring in both our Black and white cell lines. Next slide, please. So before we could actually begin, we wanted to be certain that the cell lines that we were using were actually Black cell lines and white cell lines. And to do this, we went to look at West African ancestry analysis done by the Kittles group. Here on the chart, you can see that we have two cell lines. We have our MCF7 and we have our HCC 1500. If we look at the receptor status, we know that these are luminal A subtype for breast cancer because we see that the estrogen receptor and the progesterone receptor are positive in both of these cell lines. Now, when we are looking at the ancestry for MCF7, it is clear that the European percentage is 95.1%. So we consider that our white cell line. And when we look at the HCC 1500, the ancestry for West African is 78.8%, with European being 20.7%. So again, we are looking at this and we're using this as our Black cell line. So now that we have the appropriate cell lines and we verified the ancestry, we wanted to move forward with looking at how to expose these cell lines to paraben treatment. And so to do that, we plated these cells and then we treated them with the three parabens, those three common ones that we found from the EWG: methylparaben, propylparaben, and butylparaben. And because we already know from literature that parabens do cause breast cancer cells to express genes that can be linked to cancer and hormone action, we wanted to look at the pro-tumorigenic effects. And for pro-tumorigenic, we just mean an increase in the cancerous characteristics in normal cells. So to do that, we wanted to measure cell growth and then also look at estrogen target gene expression, whether or not we're seeing a prevention of cancer or whether we're seeing it causing cancer. And here are the findings. So we looked at cell survival first. Are these breast cancer cells actually surviving after being treated with these parabens? We saw with the Black and white, when we looked at methylparaben and also propylparaben, that there was no change in both cell lines. However, things changed when we did look at butylparaben. As you can see here with the Black cell line, we did see an increase of survival when we exposed these cells to butylparaben. And that increase was not observed in the white cell line. And then we also saw that estrogen, which we just use as a control because we expect estrogen to always be increased, it was normal. So from here, we did know that butylparaben was having some effect, and it seemed to be that the Black cell lines were a bit more sensitive. We then wanted to also look at gene expression. Remember, we're looking whether or not we're seeing an increase or a turn on of those cancerous genes or whether they're being stopped and decreased. So we looked at TFF1. TFF1 is a gene that is turned on by the estrogen receptor, and it also plays a role in breast cancer. We looked at other genes, but for the interest of time, I'm going to go over this one. I will preface by saying this data is published, and we will share those resources with you, so you can also look at the data as well. But when we looked at propylparaben, we did see that both Black cell line and white cell line had an increase of gene expression when we saw higher dosages of propylparaben being exposed to those cell lines, but it was also greater in the Black cell line. And the same was seen for butylparaben. We saw the exact same results in both cell lines, but again, it was greater in the Black cell line. And so to summarize everything, we did see that when we looked at cell survival, butylparaben did increase the survival of the Black breast cancer cell line, and that was not observed with the white breast cancer cell line, as well as there was no effect whatsoever with methylparaben and propylparaben looking at cell survival. However, when we looked at estrogen target gene expression, we did see that higher amounts of propylparaben and butylparaben did increase gene expression, but there was no effect when we looked at the methylparaben exposure. And so these are the results that we have for you today from the lab. And now that we know that there is a greater burden in the Black breast cancer cell lines and that these cells may be more sensitive to parabens, I'm going to turn it back over to Dr. Teteh so she can give us some tips and resources on how we can reduce our exposure in our everyday life.
Thank you, Dr. Tapia. So we are going to have Tiah also join us as we go through these last few slides. So for the sake of time, what we'll do is I noticed a lot of the questions are in the chat are related to resources. Where do I find information, etc. So what we'll do now is I'm going to leave the next two slides has resources and information for you. One of them is the Bench to Community Initiative website, the Not So Pretty documentary. Tiah and I actually did an interview with a number of experts in this area to discuss this very question with them and provide resources with you all as well. And the last one is the Non-Toxic Black Beauty Project. So there are going to be a number of links that's going to be shared with you in the chat. I don't know if Tiah wants to go over those now, but I'm going to give you all an opportunity to take a screenshot of this particular screen to get additional information about this topic area. And then the next one are actually resources at your fingertips, including applications, Google Chrome, extensions, and websites that you can use today to get more information about the types of chemicals that are in your personal care products. So Cleria specifically was created by Amit Rosna, whose wife is also a breast cancer survivor, and they were wanting to know what resources were out there to help them figure out the types of chemicals that were in their products. Because as I stated earlier, unfortunately, legislation here in the United States does not prevent some of these chemicals from going into our products. So this is a Google Chrome application as well as an app that you can download today to help you get a better idea of what's in your personal care products and other products before you purchase them. Environmental Working Group Skin Deep Database is also a website as well as an application that can provide similar information to you as well. So I'm going to invite Tiah to come on now and to share go over some of the Q&A questions, and then we'll just use the slides moving forward as a resource. Is that okay, or do you want me to take the slides down?
No, that's fine. You can keep them up. I'm fine with that because I know people probably want to grab the resources. As we stated, I've seen a lot of questions about these resources. So I'll jump right in because we have a lot of questions. So with regards to the products that we're talking about, why is it that most of the products are, when we look at children specifically, why are they being targeted to the vulnerable population, which are children? Is that something that you could possibly answer?
So I'll answer that in a general sense, and that is to say that the United States, when compared to the European Union, for example, does not regulate our personal care products as stringently. So up until last year, when the MOCRA Act was legislated, the only federal legislation that we have on the books bans 11 chemicals of concern versus almost over 1,500 that's legislated and banned in the European Union. And so unfortunately, the myth is that if I can go to Target or Walmart or anywhere, if I pick up a product, the myth is that it's safe. It's safe for me to use. And unfortunately, that's not the case. Information that is on our personal care products, such as natural or organic, for instance, it's not legislated. We don't actually have a particular definition or description of what is constituted to be natural or organic. So what I would encourage people to, what I would encourage people to do is essentially utilize some of these applications to get a better idea of what your exposure is from these endocrine disrupting chemicals, because the types of chemicals that are going into our personal care products are unfortunately not legislated.
Thank you. So you talked a little bit about hair dyes, and we have a few questions around hair dyes. One is, where can we find more information around hair dyes and perms? But is hair dye actually safe to use? Being that we saw the data that has been presented, is it safe? Can we use it?
So I'm going to refer back to the literature, right? So there are terms that I specifically use, which was association to the literature that we have about this particular project related to hair dyes and relaxers, is that there's a strong association with use, frequency, and the type of products, whether you use it at home or with a professional, that can increase your risk for breast cancer. And so I can't answer the question, is it safe? But what I can say is what the literature is telling us, that there is a strong association that individuals that use it versus those that do not have an increased risk for being diagnosed with this particular type of disease.
Thank you. So I want to just kind of, jump into this. We talked a lot about EDCs and how it's impacting women, but we know breast cancer also affects men. So how does the EDCs actually impact males?
That's a great question, and it's out of scope with the work that I'm currently doing now. But what we do know is that these EDCs, or endocrine disrupting chemicals, are also found in phthalates specifically, and also parabens are also found in urine of males. And those have been shown to have some associations with prostate cancer, for example, but this literature is very limited. So I think I saw in the chat that someone stated that, well, there's not enough research to say that, if you do this, then you are going to get this. And that is absolutely correct. The literature is not stating that there is a causal relationship, but we are showing that there is a relationship. So what we're not saying today is that if you use these particular products that you are going to get breast cancer. But what we are saying is that there is an increased risk, whether you are a male or a woman or a female, that using these particular products versus those that have not, there is an increased risk for getting specific diseases like breast cancer. Diabetes is also another health outcome, and also reproductive complications is also an area of study that is being shown to have this effect as well. And as Jazma has also shown, there are some biological impacts to using these particular products from the breast cancer landscape, specifically focused on luminal A breast cancer. So men and women are impacted. So some of the information that I share, that we have higher concentrations in urine samples, Black women do. This goes as early as as children. So Black boys and also Black girls have higher concentrations of these chemicals in their systems than their white counterparts. And I don't know, Jazma, if you wanted to add some context to that from the laboratory perspective.
Yes, no, I think you touched on it all. There is limited data, but again, we're talking about endocrine disrupting chemicals, right? So they are going to disrupt our endocrine system, and we would expect that men would have some adverse reactions as well. And just like Dr. Teteh said, it goes all the way back to birth. I don't want to talk out of the scope of the project, but you guys can look up some research on this. There are research on transgenerational as well effects as well with the parabens, and we suspect that that might have something to do with why we're seeing this so early on.
And Dr. Tamara James Todd specifically, who is also a Black scholar in this space, she has a number of research studies focused specifically on reproductive outcomes, if folks want to check that literature out.
Yeah. And I want to quickly pivot to the big F, fragrance. Fragrance is in everything. It's in our trash bags. It's in, we use them for plugins, on our bodies, in our lotions. I mean, what you name it, shampoos, it's in everything that we use. What are some safer alternatives that we can use in our homes and on our bodies to smell good?
I think that's a great question. So I'm going to pivot to the Non-Toxic Black Beauty Project. And then we're also going to share other resources with you all to again, if you want to know, okay, if you're telling me all of this is bad, well, what do you want me to use, right? And there are a number of resources, including the apps. And if you don't want to go through looking at information, et cetera, we actually have over 800 beauty products that are made by Black individuals, Black businesses across 78 brands that can help you start your journey towards reducing your exposure to these endocrine disrupting chemicals. So this particular database is actually supported by the current research that we have, not just for breast cancer, but again, for diabetes, and reproductive complications, et cetera. And it's supported by over 141 different peer-reviewed publications, and we use that as a resource to help develop this particular database. And so this is one way that you can find different products like fragrance that are lower in EDCs that may be safer for you to use as well. So the Non-Toxic Black Beauty Project is one resource that I would share with people and would encourage you all to take a look. Another resource that is also was developed by a Black woman, a PhD as well, is the Black and Green Marketplace. Is set up just like Amazon, and it's also supporting Black-owned businesses. So all of the products that are available on that website have gone through their own specific stringent process. They use a lot of the chemicals of concern from the Environmental Working Group, as well as other resources. And this marketplace, you can go and shop, knowing that the products that you are getting have lower EDC exposures to you as well. So those are two resources that I'm going to share. And I believe there's also a link for the Anti-Cancer Lifestyle website that has information related to households and other personal care products that you would want to check out as well.
Yes, and I'm so glad that you brought up the Non-Toxic Black Beauty Project, because some of our giveaways, those companies are actually listed on the Non-Toxic Black Beauty Project. So thank you so much for bringing that up. And, you know, it's really important that we even have this type of list, because so many of us have asked the questions. I know I've been doing this since I was diagnosed in 2015. You know, what products are you using, right? And we know that the products do vary from person to person based on your own skin, your hair texture, so forth and so on. And when we look in our communities, you know, there are beauty supply stores that are everywhere in our communities, and a lot of the products that they're selling actually have those harmful chemicals. Well, speaking of hair, you know, Black hair is a huge part of our identity as Black women. And for many years, we've had to deal with the challenges of our natural hair in the workplace. And I know that you mentioned the Crown Act. You know, sadly, I see this as one of the contributing factors that may have led to us making these choices that are knowingly unsafe. So how can we find out if the Crown Act is actually in our state? And if not, what can we do to advocate for it?
Yeah, so the Crown Act, if for those of you that do not know about this particular legislation, I hope you find out more. And there's a link to the petition that I believe is going to be dropped in the chat as well. And this particular legislation actually started here in California by then Representative Holly Mitchell. And this is to ensure protection against discrimination based on race-based hairstyles by extending the statutory protection to hair texture and protective hairstyles like my hair, like locks, curly hair, like Tiah's and Jazma's, et cetera. And this is an opportunity for you all to get engaged as a part of this conversation. So unfortunately, there are places like, for example, Tiah just sent me an article where there was a Texas Black boy who had locks, and he was suspended for bringing his locks into school because it didn't adhere to the school's rules. Texas actually just recently passed the Crown Act, so it'll be interesting to see how that particular story unfolds. And so if you want to get more information as to whether the Crown Act has been passed in your state, you can simply go to thecrownact.com. And if it has not been passed in your state, there is a petition that is ongoing that you can add your name to. I also want to encourage people to contact their legislators and this particular petition will help you get started with that process, and it'll give you language around sharing with your legislators why this particular topic is important as well.